Well, cannabis has been legal in Canada now for 6 months. Tokyo Smoke, other stores opening up everywhere right now. But there is a bit of a quandary when it involves medical marijuana. So on Breakfast Television this morning, we had a chance to talk to Dr. Landolt, who's been prescribing medical marijuana for some time now, and got her thoughts on what needs to be done so it is properly managed within the system.
It is true that with doctors, you do have a huge reluctance. There isn't a lot known. And right now there's a huge amount of bureaucracy or education required to get your patients on medical cannabis. What I have seen is most doctors want to do right by their patients. So if your patients are prescribed medical cannabis and they go back and they say, you know what, doc, I had a great experience, I'm lowering my narcotics, or I'm getting off some other medications, I'm doing better, I think that's a very powerful thing for most doctors. Most doctors will say, you know what, I'm more comfortable now. I still don't know what's going on, particularly with this area, but I'm more comfortable because the reports I'm getting from my patients are positive.
Do you see the big pharmacy companies getting involved in this, and do you think that's a good thing?
I do see them getting involved. I think this goes both ways. So I think it's good in the fact that pharmaceutical companies are expert at taking a product and packaging it or in formulations that are sort of medically acceptable. Patches, capsules, more formal sort of inhalers, that's all great. They're going to do a lot of research. They're going to really kind of refine what we currently have, which is, I think, a fairly crude formulations. My concern is cost. So, for example, right now there is no coverage for medical cannabis. So here you have people who, for example, can decrease their narcotics, but now they can't afford the thing that's allowing them to do that because they can't. There's no coverage. So we cover certain things and we don't cover this. If pharmaceutical companies come into this, will this be an opportunity for coverage? If that's the case, great. If it's just going to be one more level of processing that's just going to ramp up pricing, from a patient perspective, that's not good.
If you're looking for more information on medical cannabis, you can go to Dr. Landolt's website, which is summertreeclinic.ca.